Incision placement and therefore scar placement matters, and this is a great example of why. So this is a patient who came from an outside physician and had a previous procedure done many years ago and was left with a scar that was in a very conspicuous location, both in front of the ear and behind the ear, as we'll see. So for example, on this right side, you can see that the scar is out in front of the ear, in front of what's called the helix, which sits right under the temporal hair tuft. So it's about 1 centimeter out in front of that, and that's in a much more conspicuous location than we should have. It doesn't sit in the natural groove where it's practically invisible. Finally, you can see behind the ear, it's stretched out, not in the crease, right behind the ear, not in what's called the postauricular groove or postauricular crease, but out beyond where that groove is and out into the neck. These can be very traumatic for patients because they can't wear their hair up as they'd like to, or even with their hair down and just barely over the ear, in front of the ear. So what you don't want is for friends to say, hey, what's that white line in front of your ear, or what's that scarring behind your ear? You want them to say, well, you just look great. I don't know why you don't age. So that's our goal, and that's one of the many details that we take into account is scar placement with our LuxeLift procedure, and that's what helps set our results apart from others. So it's important to get this done right the first time. In this case, we were able to reposition her scars. This was a revision LuxeLift procedure and create a more favorable appearance of the scars, which we'll be able to show later once she's beyond her 1 month follow-up. So thanks very much. If you have any questions, feel free to ask below. Take care.